Hello, my name is Laura Gillette, and I'm a clinical staff educator, and today we're going to go over postmortem care. If you have a patient that is terminally ill or has already passed, implementing the following courtesies will help families transition through this difficult time. So we're going to provide privacy, listening skills. Touch can convey a lot of care and concern. We would like to prepare the room with extra Kleenex boxes, point out where the bathrooms are, provide extra chairs for family. We can also get the comfort cart. This can be obtained through either the director and or nursing supervisor on the off shifts, and that will provide some tea, coffee, a few little amenities that'll help soothe the family members should they need it. Also, we're going to respect cultural and spiritual needs. Sometimes these family members absolutely have some community leaders that they follow, and we welcome those strengths at the bedside to help families transition. Sometimes members of the family can be emotionally distraught. They could be at any stage of the Kubler-Ross 5 stages of dying. As a reminder, that is denial, anger, bargaining, depression, or acceptance. So we need to anticipate those kind of needs should they arise. We're going to allow as much time as possible for family to say their goodbyes at the bedside when they are looking for direction for the next step. We're going to provide them with a prayer candle, explain that postmortem process if you haven't already, and answer any questions that they may have. When the death finally does occur, you're going to call the doctor first so that they can come and pronounce the patient. And while the doctor's there, have them enter a release to the morgue order so that you don't have to call the doctor back. Also, you're going to notify the director or for off shifts, nursing supervisor, so that they can plan for staffing accordingly. The New England Donor Services, also known as NEDS, will call you after speaking with admitting. NEDS will follow up with the family regarding donation. So that's an awkward situation that you don't have to deal with, which is fairly nice. You do, however, have to have ready the patient's chart just so you can provide any additional information that NEDS may need. You're also going to want to remember or write down the person that you spoke with at NEDS so that you can include that in your documentation. Make sure all the treatment modalities are shut off for the patient. It just is unsettling to see the IV fluid still infusing in, or oxygen still on, or the Venadine boots circulating. So we want to make sure that those are turned off. If the patient has come in within 24 hours of admission or has had recent surgery, or there's any other suspicious issues involved, you might want to have the doctor think about the medical examiner if that's appropriate as per their order. If that's the case, you're not going to remove any lines or catheters until after the medical examiner looks at the patient, and by then they're not going to be in your care anymore. The other issue is if the patient's going to have an autopsy, you're going to leave the lines and catheters in place as well. Before the family leaves, you want to make sure that there are no more family that are planning to come in to see the patient. You want to also have an idea of which nursing home, funeral home they're going to use, just in case you have to facilitate some of that communication. You're going to send home the belongings with the family. If they agree with that, you're also going to write down the name of who you gave the belongings to. If the patient doesn't have any family, then their belongings, including jewelry, will be sent with the patient, and just have a colleague witness a signature and or electronics documentation that indeed they witnessed the belongings of the patient going with the body to the morgue. Postmortem care looks like what I have outlined right here. The shroud is fairly straightforward. It only includes the shroud itself, some ID labels in which you're going to put on the patient's identification stickers. 2x2s and tape you'll have to grab separately, and or a syringe to remove a catheter should the patient have a Foley catheter. When you first come into the patient, you're not going to take off their original ID band. You are going to do your 2 to identifying factors with the patient's band with chart information. You're going to give the patient a bath, oral care, insert dentures if they have them. If you're unable to get them in, you're going to send them with the body to the morgue. You're going to keep the patient in a supine position with the head of the bed just slightly elevated because you want to prevent that facial discoloration and swelling. You're going to apply 2x2s and tape to all the puncture sites. With those 3 tags that are included within the shroud bag, you're going to put the ID stickers with the date and time of death, the provider's name, and the first one goes on the great toe, the second one goes outside the shroud, the third one goes on the patient's belongings. You can call for a concealment cart and notify transport and or security for assistance getting the body to the morgue. Family typically will notify the funeral home, but you can assist as well, should that be the case. If the patient required any kind of isolation precautions, you're going to continue them until they're actually delivered to the morgue. Just a recap on documentation and transport. The 4 things you want to make sure you include in your documentation is that you did perform postmortem care and the person you spoke to at the New England Donor Services, the disposition of the patient's belongings, and the date and time the deceased patient was transported to the morgue. When transporting, please be sensitive for the privacy of the patient, and it is often a little disconcerting to see the concealment cart, so we try to close doors, privacy curtains with the patients and families that are still cognizant. Self-care. So this is a big deal and is ongoing. So death is a natural yet complicated process involving physical and emotional and spiritual aspects. As nurses, the relationships with our patients and family can have a lasting impact on our lives. If you are struggling with any kind of emotional or spiritual healing, please reach out to MGB's Employee Assistance Program for support. Contact information can be found on the Connect page and or by calling the operator. Thank you very much. Take care.
Here are some additional resources on death and dying you can find in Lippincott Procedures: the dying patient care, care of a dying patient neonatal, postmortem care pediatric, fetal demise care. Also, we have MGB, Salem Hospital Nursing Administrative Policy for patient death. And there is an MGB Salem Hospital Spiritual Care Department. Sharon Dickinson is an excellent source. She is our Director of Spiritual Care. She is also always willing to reach out to help. We have a postmortem binder on the units that you can refer to as well. And for nurses, you can go into the HealthStream course, Care for the Dying Patient, Organ and Tissue Donation, that you completed as a new hire, and you can review this too as necessary.